It is now my pleasure, I'm delighted to be able to do it, to introduce my delegate, Rainier Mallol, who is a 25-year-old from the Dominican Republic. Rainier is a co-founder and the CEO of a company that he created called AIME, and it is a company that's involved in the field of epidemiology. In fact, Rainier and his company have created a tool that will allow countries to know ahead of time, to predict where diseases may break out and when they may break out. As you know, climate change is causing changes in the patterns of where diseases can occur. We're all familiar with dengue fever, we're familiar with the Zika virus, and these have enormous impacts on the health of a country. So having a tool to know where there may be, at some future date, an outbreak is an extremely important tool to have. And in fact, Rainier's company is involved at the moment in 3 countries, Brazil, the Philippines, and Malaysia. I think that given the fact that this is becoming more of a reality today, the company, AIME, and Rainier are making an enormous contribution to our planet. So it's my pleasure to introduce Rainier Mallol.
In the next few decades, millions are more likely to die, not due to war or missiles, but microbes and disease. Allow me to explain you why. It is a scientifically proven fact that our world is changing. This summer, NASA confirmed that July 2016 was the hottest month in recorded history. And while these changes in temperature do not increase floods, droughts, and sea level rise, they also affect our city's public health. You see, when our cities become hotter and more humid, it creates the perfect ecosystem for deadly organisms to form and exist. It is because of these changes that we have seen a fatal trend in the ecological behavior of deadly organisms called mosquitoes, specifically the Aedes aegypti mosquito. These beings are able to carry multiple diseases, including dengue, chikungunya, and the infamous Zika. It used to be that these beings only appeared in tropical climates, such as in my beautiful country of the Dominican Republic, in Central and South America, and in Southeast Asia. But now the data shows otherwise. We now have Zika cases in Spain, dengue outbreaks in Argentina, breeding sites in Japan, South Korea, in cities of the United States, and even in the United Kingdom. These diseases affect more than 500 million people every year, putting at risk 2.5 billion people. And they also cause a significant economic impact. For example, dengue in Brazil costs more than $1.3 billion every year. As an engineer, as a businessman, and as a United Nations young leader, I believe that it is now more than ever that our methods to tackle infectious diseases must evolve. They must become intelligent systems that could not only perceive and understand these complex changes in the environment, but that could also exponentially increase our chances of survival. 1 year ago, I started a journey with Dr. Desi Raya, a world-class scientist who had done extensive research on a disease called dengue. This disease can cause organ failure, high fever, and can kill in 3 days. I could relate to it because my mother, my brother, my cousins, my friends, my colleagues, they all have had it in the past. And in the Dominican Republic, where I am from, it is the first disease we think about when one of our loved ones show any kind of symptoms. Desi and I formed an organization that we called AIME, with the mission to empower public health professionals through innovation. We found a way to create an artificially intelligent algorithm capable of predicting the next dengue outbreak 3 months in advance. This means that for each 100 outbreaks we predicted, we could pinpoint 88 of them in advance. And this algorithm works because we took in consideration aspects such as weather, geographical, and socioeconomic data. It is truly an algorithm that understands not only the pattern of the weather and of us humans, but that can also and most definitely understand climate change. It uses this understanding, this information, to obtain amazing results. In AIME, we use this tool to help national governments, NGOs, multilateral organizations to prevent the spread of deadly diseases. Recently, we celebrated our first birthday, and we have had immense traction in our first year with projects in Malaysia, Philippines, and in Brazil. In next year, we're going to deploy into the Dominican Republic and in India. We've also created new algorithms capable of predicting Zika and chikungunya outbreaks as well. We are the living proof that technology can understand climate change, our cities, our citizens, and our ecosystem, probably better than ourselves. It can help us adapt and succeed against the challenges of climate change. And it is up to us to be creative with this technology and use it to help those in need. Thank you.